Welcome to ICUBA's annual enrollment for the 2023-2024 benefit plan year. ICUBA means strength in membership. In welcoming St. Thomas University to ICUBA, the group is now 26 member schools strong. Coming up, changes and enhancements to your ICUBA benefits effective April 1st, 2023. Effective April 1st, 2023, Blue Cross Blue Shield will be ICUBA's new pharmacy benefit administrator. If you're enrolled in a medical insurance plan, you'll receive a new member ID card for medical and pharmacy coverage combined. You'll need to present your new cards at the pharmacy when filling prescriptions. Your old cards from Optum will no longer work. Your pharmacy copay tiers will remain the same, but some medications may change tiers. For more information about what to expect with your new pharmacy benefits, scan the QR code on screen to read the welcome letter from Blue Cross Blue Shield. On April 1st, the Rally Wellbeing Incentive Program is going away. ICUBA is partnering with Strive, powered by Virgin Pulse, to give you access to an innovative well-being platform that's easy to use and make part of your life. You'll be able to log into your My Health Toolkit account on April 1st, then select Wellness, then select Strive. This is where you'll begin the health assessment, a short, confidential survey that assesses your health across factors ranging from fitness to your mental health. You'll receive a personalized report with suggested steps that will work with your lifestyle. Remember to redeem your Rally incentives before March 31st, 2023 to avoid losing any incentives available in the platform. If you or an eligible family member has been diagnosed with type 2 diabetes, ICUBA will fully cover the cost of participation in the Virta Health program. Virta is available to ICUBA members and eligible dependents between the ages of 18 and 79 with type 2 diabetes. Some medical conditions may exclude patients from Virta treatment. To find out if you qualify, visit virtahealth.com/join/ICUBA. If you've ever worried about becoming a victim of identity theft, losing your wallet, using public Wi-Fi, or being mistakenly pursued by a collection agency, you may benefit from ID Shield. ICUBA already provides the Legal Shield coverage you know and love. Now you can add an extra layer of protection with full-service identity restoration and monitoring services. For more information, visit icuba.me/legalshield or scan the QR code on screen. Healthcare flexible spending accounts require you to make a new election each year during annual enrollment. Your election is advanced by your employer and available for immediate use in the new plan year. You pay toward your election each pay period on a pre-tax basis. Enrollment in a medical plan is not required for participation in healthcare flexible spending. Please keep in mind, flexible spending accounts expire at the end of the plan year and have a grace period until June 15th of the following year. Dependent care flexible spending accounts also require you make a new election each year during annual enrollment. But unlike healthcare flexible spending accounts, they're not advanced for the plan year. Your election is funded by your employer each pay period. Dependent care flexible spending account funds can be used for expenses related to the physical care of dependent children under age 13 or adult disabled dependents who are unable to provide self-care to enable you to attend work or school. You pay toward your election each pay period on a pre-tax basis, and just like the healthcare funds, the dependent care funds expire at the end of the plan year with a grace period until June 15th of the following year. Coming up, enrolling in your benefits online. Enrollment at FIT is easy with Workday. Log into Workday using your Trax username and password. The Open Enrollment event will show in your inbox at the top right-hand corner. Scan the QR code on screen for FIT's Trax resource page if you need any assistance accessing your Trax account. During annual enrollment, you're encouraged to review and update your benefit elections for the new plan year. The elections you make during annual enrollment will remain in effect until the end of the plan year as stipulated under Section 125 of the Internal Revenue Code. You may only change your elections during the plan year within 30 days of a qualified life event. Be sure to email or print your enrollment confirmation once you complete annual enrollment. Eligible dependents include your legal spouse or domestic partner, a child or stepchild, legally adopted or foster child, a child required to be covered pursuant to a qualified medical child support order, or a child who resides with you as their legal guardian. A child is considered a dependent until the end of the calendar year in which they attain age 26, or if they are over 26 years of age and continuously incapable of self-support because of a disability. Up next, medical insurance from Blue Cross Blue Shield. Your ICUBA medical insurance is more than just medical. Every medical insurance election includes plan enhancements from Embold Health, Surgery Plus, Virgin Pulse, Hinge Health, Virta Health, My Health Novel, and Able 2. When you elect medical insurance from Blue Cross Blue Shield, your behavioral health benefits from Aetna are bundled but administered separately. This means you need to present your Blue Cross Blue Shield ID card for medical and pharmacy visits and your Aetna ID card for behavioral health services. No cost, no deductible, no barriers to care. ICUBA's benefits are designed to identify and treat chronic conditions before they become a problem. That's why we have no-cost programs like $0 copay for total care and Embold Health designated providers, and no-cost services like mammograms and adult and child immunizations. With ICUBA's medical insurance plans, you only pay for your deductible when you receive major services. The Preferred PPO Plan has an individual deductible of $2,500 in network, a family deductible of $5,000 in network, an individual out-of-pocket maximum of $4,000 in network, and a family out-of-pocket maximum of $8,000 in network. The coinsurance for covered services is 20%. The high deductible PPO plan from ICUBA has an individual deductible of $4,000 in network, a family deductible of $8,000 in network, an individual out-of-pocket maximum of $5,350 in network, and a family out-of-pocket maximum of $10,700 in network. Coinsurance for covered services in network is 30%. Effective April 1st, 2023, there'll be some changes to ICUBA's prescription drug plan. Blue Cross Blue Shield will be our new pharmacy benefit administrator, and you'll receive a new card for your combined medical and prescription drug coverage. There will be no changes to your core prescription pharmacy benefits, and your prescription tiers and your prescription copays will remain the same, but some of your drugs may move from tier to tier. There will be no change to the free preventive medications available for chronic conditions, and no change to the free diabetic supplies available under the medical insurance plan. Please scan the QR code to read the BCBS Pharmacy Benefit Welcome Letter. With a prescription from your provider, you can receive free prescribed diabetic supplies, including meters, lancets, test strips, control solution, needles, and syringes. Other items include prescribed aspirin for adults, prescribed generic folic acid, and generic prenatal vitamins for pregnancy. Simply take the prescription to the pharmacy counter, and your local pharmacist will do the rest. An ICUBA Cares pharmacist can be your liaison between the doctor, the pharmacy, and the insurance company, taking the burden off you. For assistance, please call an ICUBA Cares pharmacist Monday through Friday from 9 a.m. to 5 p.m. Press option 4 after the prompt. Up next, behavioral health benefits and employee assistance program from Aetna. Aetna Behavioral Health and Resources for Living Employee Assistance Program are here for you. Fear and anxiety can be overwhelming and cause strong emotions. Coping with your stress in a healthy way will make you, the people you care about, and your community stronger. Behavioral health services are attached to your medical coverage, but administered separately by Aetna. This means you need to use your Aetna ID card and search for behavioral health providers in the Aetna portal when verifying coverage. If you don't provide your Aetna ID to behavioral health providers, your claim could be denied, and your out-of-pocket costs could be higher if the provider is not in the Aetna network. Even though your deductibles and out-of-pocket maximums are combined with your Blue Cross Blue Shield medical insurance, if you see an out-of-network provider, you will have higher costs. Up next, exclusive benefits for ICUBA members. You can use Teladoc when you need care on the go, have a non-emergency issue, or if you need short-term prescription refills. Teladoc is a convenient and affordable option for care, but it is not intended to replace your primary care provider. Teladoc doctors can treat minor medical conditions, including, but not limited to, cold and flu, bronchitis, sinus infections, and more. All Teladoc physicians are board-certified practitioners in pediatric or family medicine with at least 15 years of experience. Teladoc is available to ICUBA medical plan participants for a $5 copay. Surgery Plus provides ICUBA members with access to high-performing surgeons of excellence for covered surgical procedures. Surgery Plus providers are not your regular network providers, and you may need to travel away from home for your procedure. But don't worry, if you do travel, Surgery Plus pays for travel expenses and hotel accommodations for you and a companion. When you schedule your eligible elective procedure through Surgery Plus, the deductible and co-insurance are waived. You pay nothing out of pocket. Surgery Plus also offers full concierge service with a dedicated care advocate to assist you along your healthcare journey. Unlike other diabetes and weight loss treatment programs, Virta goes beyond just treating the symptoms of the disease. With Virta, you learn how to change how you eat so that your body burns fat for energy instead of sugar and carbohydrates. This can help you naturally lower your blood sugar and reduce the need for diabetes medication. It can also help you lose weight and live a healthier life. ICUBA fully covers the cost of Virta for you and eligible family members with type 2 diabetes. Effective April 1st, 2023, ICUBA's new well-being program provider is Strive, powered by Virgin Pulse. If you're ready to strive for excellence, enroll in Strive now by logging into your MyHealth Toolkit account, selecting Wellness, then select Strive. You can scan the QR code on screen to take you directly to the MyHealth Toolkit login page. MyHealth Novel is designed to match you with helpful resources and tools based on your specific needs. These services are available at no cost to all ICUBA members who are enrolled in a Blue Cross Blue Shield medical plan for weight management, diabetes prevention, and intensive behavioral counseling, among others. MyHealth Novel gives you access to the best nutrition, physical activity, and weight management tools, programs, and apps available. With Hinge Health, you and your family members have access to all the tools you need to manage pain and virtual musculoskeletal care. Participants report an average pain reduction of 60%, and it only takes 45 minutes per week. Once enrolled, you'll receive the Hinge Health Welcome Kit, which includes a tablet and wearable motion sensors that guide you through exercise therapy. You'll also be paired with your personal health coach, who will tailor your sessions to you, your schedule, and your pace. For more information and to register online, visit www.hingehealth.com/ICUBA. With the Able To program from Aetna, you'll get virtual, personalized support that can help you feel better. You'll learn how to manage your emotions and improve your overall health, and your mental and physical health can improve in as little as 8 weeks. Plus, this program is already included in your Aetna coverage from ICUBA. Able To can help you work through normal emotions, know the types of changes you need to make, and feel like you're in control of your health and your life. It's really easy to take the first step. In fact, you can speak to a licensed therapist within 7 days or less from calling. With Bold Health, you have access to the highest quality providers in the Blue Cross Blue Shield network. Bold Health complements the current $0 copay for total care primary care and pediatric visits. If you visit an Bold Health designated provider, your visit will be covered at 100%. That means no money out of pocket. Provider eligibility may vary from year to year. To verify your provider is an Bold Health designated provider, visit ICUBAbenefits.info and click on the Bold Health tab in the navigation pane, or you can search for providers in My Health Toolkit. Coming up, dental benefits from Delta Dental. With Delta Dental, you can select from 2 PPO plans, the Base PPO Plan and the Buy-Up PPO Plan. The Base PPO Plan has a $1,500 plan year maximum and only covers orthodontia for children, up to 50%, and a $1,500 lifetime maximum. The Buy-Up PPO Plan has a $2,000 plan year maximum and covers both adult and child orthodontia at 50%, up to a $2,000 lifetime maximum. The Base PPO Plan from EyeMed is for prescription glasses and contact lenses, not for the medical treatment of conditions like glaucoma or cataracts. The Base PPO Plan has a $130 frame allowance every 24 months, with a $5 exam copay and a $15 single vision lens copay. Frequency is based on your date of service. If you receive an exam today, you're eligible for another exam in 12 months. Contact lenses are in lieu of glasses. That means you're entitled to a full pair of glasses, frames and lenses, or contact lenses. Additional discounts are available. Coming up, income protection from Symetra. Income protection benefits from Symetra include basic life insurance, basic accidental death insurance, spouse and child life, and disability products. Annual enrollment is a great time to review and update your beneficiary information. Some products may not be available at your institution, and age restrictions and enrollment limitations may apply. During annual enrollment, you may have an opportunity to increase your life and disability coverage. Doing so may require you to provide evidence of insurability, or EOI, to Symetra. If EOI is required, you'll receive a message like the one highlighted on screen. This EOI process must be completed following enrollment, and your coverage must be approved by the insurance carrier before it becomes active. The connection to Symetra will be initiated after your enrollment is finalized. Please do your best to answer the questions. This is the only opportunity you'll have to complete the process. Symetra will contact you if they have any questions about your submission. Evidence of insurability is generally required when you elect coverage in excess of a guaranteed issue amount or make elections after the initial eligibility period. Example scenarios include adding disability benefits to existing coverage or applying for group life coverage that exceeds the amount you were previously approved for. Up next, legal protection from Legal Shield. It's important that we safeguard our physical health, but also our financial health and legal rights. With Legal Shield, you can protect your legal rights at an affordable rate. Legal Shield provides you and your family direct access to a dedicated law firm that can review and prepare legal documents such as wills and assist with other personal legal matters like speeding tickets, neighbor disputes, and family-related matters such as adoption. It's important to safeguard our physical health, but it's also important to consider our financial health and legal rights as well. With Legal Shield, you can protect your legal rights at an affordable rate. Legal Shield provides you and your family with direct access to a dedicated law firm that can review and prepare legal documents like wills and assist with other personal legal matters such as speeding tickets, neighbor disputes, and adoption. Now with the combined power of Legal Shield and ID Shield, you don't have to worry about becoming a victim of identity theft, losing your wallet, or using public Wi-Fi. ICUBA already provides the Legal Shield coverage you know and love, and now you can add an extra layer of protection with full-service identity restoration and monitoring services. For more information, visit icuba.me/LegalShield. Up next, personal insurance from Aflac. Aflac Critical Illness can help you with the treatment costs of covered critical illnesses such as heart attacks and strokes. More importantly, the plan helps you focus on recuperation instead of the distraction of out-of-pocket costs. With the critical illness plan, you receive cash benefits directly unless otherwise assigned, giving you the flexibility to help pay bills related to treatment or to help with everyday living expenses. Every employee is eligible to enroll in the critical illness plan regardless of health, and all covered illnesses in the policy will be covered as long as the diagnosis is after their policy effective date. Even a planned stay in the hospital can be expensive, as you meet your deductible and your out-of-pocket costs under the medical plan. The hospital indemnity plan is designed to provide financial protection by paying you a direct benefit to meet your out-of-pocket expenses and extra bills that can occur. Lump sum benefits are paid directly to you based on the type of facility and number of days of confinement. The Aflac Accident Plan is designed to help cover the expenses associated with an accidental injury. The plan pays cash benefits directly to you for emergency treatment, hospitalizations, specific injury treatments, diagnostic exams, and accidental death. Plan features include emergency room payments of $175, X-ray payments of $50, payments for hospital admission of $1,000 per confinement within 6 months of an accident, and a wellness benefit of $50. Up next, pet insurance from Nationwide. Nationwide is on your pet's side. All employees are eligible for preferred pet insurance pricing through Nationwide. You'll have the option to choose, on a direct bill basis, the level of coverage that fits your needs, ranging from 50% to 90% reimbursement on vet bills and more. Thank you for viewing ICUBA's 20th Annual Enrollment Presentation. We look forward to bringing you better benefits through collaboration for many years to come. Please scan the QR code with your mobile phone and let us know how we're doing. Thank you.